So this video is my way of trying to explain what I know about frozen shoulder, how I think about frozen shoulder, what we know in the scientific community, and then here in our practice, our method for treating it. So, frozen shoulder is a really interesting phenomenon when you think about it, because it doesn't really happen in many other joints in the body. It does, but it's extremely rare. But in the shoulder, it's very common. And also the medical term for frozen shoulder is adhesive capsulitis. And if you break that down, adhesive meaning sticky, and then capsulitis meaning the capsule deep inside your shoulder is very, very inflamed, and that causes a very stiff, painful shoulder. And so we see this very frequently in our practice. I would say I treat probably close to 750 patients a year with frozen shoulders. And it's really a diagnosis of exclusion, meaning that someone comes in and they've got pain and stiffness in their shoulder, and there's a lot of things that can cause that. Top of the list would be rotator cuff tears. Second would be arthritis in the shoulder. And if you come in and we check an x-ray and you don't have arthritis, right, there's no loss of cartilage, and we look at an ultrasound and you don't have any tears in your rotator cuff, and you have a painful, stiff shoulder on exam, you by definition have a frozen shoulder, right? We definitely see it more commonly in women than men. I'd say it's at least 80% women. We see it more in diabetics and in patients with thyroid disease. However, in 90+% of the patients that we see it, it's idiopathic, meaning we don't know why it happens or what the true cause of this is, or we haven't been able to elucidate that yet. But what it is someone with a painful, stiff shoulder with no tear in the rotator cuff and no arthritis. And so the good news about frozen shoulder is it's self-limiting, meaning that it's going to go away eventually. It just depends on how long. And some people get a very mild frozen shoulder. Some people get a very severe frozen shoulder. People with diabetes and also with thyroid disease tend to have a little bit more severe disease. So the good news is, again, that it's going to go away eventually. However, I've seen it take up to 2 years. Now, that's not typical in most patients. I would say a typical window is 3 to 6 months, but we definitely see outliers that take longer. And so if you do absolutely nothing, it's going to go away. And I tell most patients, the best treatment for this would be if I had a time machine, which I don't, right? So we have to use the next best thing, which are we kind of use a multimodal therapy here, which includes a large injection of steroid, and not just one injection, which is what the typical treatment is, but actually an injection around your suprascapular nerve, as that nerve tends to get very inflamed and be part of this, and then also into the back of the shoulder, into the capsule, and then into the front of the shoulder as well. So a series of 3 injections, and that's a large injection of cortisone, but also a large injection of local anesthetic into the shoulder. And we send you to our physical therapist and they stretch you out, right? And by doing that, what they're doing is taking that very, very stiff shoulder and stretching out the capsule in order to get everything lengthened. Most patients don't tolerate that unless you have some sort of injection on board, because your capsule is so inflamed. And so we're really dealing with 2 things here. It's the stiffness and the inflammation, and you kind of have to attack both. If you just send someone to therapy and no injection at all, it's going to be really difficult for them to stretch aggressively with their shoulder because they're so painful and their body just shuts them down. So you really have to attack both the inflammation and the very, very tight capsule. And we book a second appointment for this, right? So that, because you have to coordinate with the injection and the therapist. And this has actually been published in a couple of different medical journals as really the most effective treatment for frozen shoulder. It has slimmed down the time it takes for us to get this to go away massively. I would say at least cuts the time in half. And typically we come in, we have you do the injection, and then you go over to the therapist, they stretch you out, and then you do several more visits of stretching. It's very, very effective. And most of our patients, I would say, when we see them back 6 weeks after the shot and the therapy, they're 70 to 80% better on average. At least 80, I'll tell patients, 80 to 90% of patients are 80 to 90% better. They may not be 100% there, but it's very, very effective. We also add in an oral prescription of prednisone to just kind of decrease the total inflammation in your body. And then we add on top of that a high dose of ibuprofen, because it's 2 different mechanisms. So you get the injection, you take 2 different medicines plus the therapy, and I have found that to be extremely successful. In addition to that, try to follow our typical anti-inflammatory lifestyle principles, and you'll get this to go away. All frozen shoulders go away. I say that with confidence. Now, I have seen the longest I've seen someone's last is over 2 years, like 2.5 years, but I have never seen an idiopathic frozen shoulder or one associated with diabetes or thyroid disease not go away. But some of them can be very stubborn. Most of the time, if you've been dealing with it for over 6 months and we've tried our typical injection therapy treatment protocols, surgery is an option for it, and we can fix it instantly. And we go in, the surgery is going in arthroscopically and just releasing the capsule. We don't do that on most patients because 99% of them we can get fixed within 6 months to a year. And I think most patients, if you tell them this is eventually going to go away, they're okay with it continuing to wait. However, there are some people with very severe frozen shoulders where or some patients where at 6 months or a year, they're still very stiff and painful and they just want their shoulder fixed, and that's perfectly reasonable. But we tend not really even have that conversation until you've been dealing with it for at least 6 months, because if you can just kind of put up with it for 6 months and follow the treatment protocols, 90 to 95% of people, the shoulder is going to start to loosen up. I also tell our patients frozen shoulders sort of like chicken pox, and that you get it once in your life in a certain shoulder, and very rare for it to ever come back again. There's about a 20% chance you can get it in the opposite shoulder, right? So good chance that you're never going to get it, very good chance you're never going to get it in the same shoulder, a 1 in 5 chance that you may get it in the opposite side. I have seen people come in with both at the same time. Yeah, frozen shoulder it's painful. It can be a debilitating problem, but fortunately we've got great treatment protocols to help get you better faster and fix it without doing an operation in at least 97, 98% of the patients I see it with. So I'm sorry you have a frozen shoulder, but fortunately we're going to get it fixed.